Assalamu alaikum. It's my honor to present an abstract that was carried out in our department by my dear professors, Professor Dr. Izzat Ali, Professor Dr. Khalid Ali, and Professor Dr. Dua Haider. The abstract was published in the International Journal of Clinical Practice, Scopus Q1, Scopus, and Q2 Web of Science. It assesses the role of computed tomography, interior colonography, in assessment of degree of ulcerative colitis activity. Ulcerative colitis is chronic immune-mediated inflammatory condition of the GIT. Long-standing cases of UC is associated with dysplasia and CRC, and so finding different modality for diagnosis is very important. The disease is characterized by remission and relapse and associated extraintestinal manifestation, and so assessment of this activity using different modalities such as clinical, endoscopy, and radiological assessment is very important. CT interior colonography can diagnose complications such as chronic stenosis, extraintestinal manifestations, toxic megacolon, and CRC. The aim of the study is to evaluate the role of CT interior colonography in detecting the severity of UC in relation to pathological findings. This is cross-sectional study included 50 patients recruited to the gastroenterology unit with suspected UC. Assessment of this activity was done at 3 levels: clinical level, endoscopy, and then CT interior colonography. Clinical level assessment of disease activity was done using ulcerative colitis disease activity index, endoscopy by ulcerative colitis endoscopic index of severity, pathologically by detection of the degree of neutrophilic invasion, crypt abscess formation, cryptitis, presence of edema, and mucosal surface ulceration. And then CT interior colonography was done to all cases. Patients with bleeding tendency, pool bowel preparation, advanced renal disease, liver disease, or hepatic disease were excluded from the study. Colonoscopic procedure was done, and endoscopic findings are further divided into normal or inactive disease, mild disease with erythema, decreased vascular pattern, and mild friability, moderate disease with marked erythema, absent vascular pattern and friability, and severe disease showing spontaneous bleeding and ulcerations. Histopathological examination was done by expert histopathologists who are blind completely to the clinical data. Quantification of the degree of inflammation was done using histological colitis score from 0 to 1. 0 showing no inflammation, 1 mild edema and inflammation of the lamina propria, 2 crypt abscess formation, 3 more severe inflammation and destructive abscess for crypt abscess formation, and 4 more severe inflammation with active ulceration. CT interior colonography was done using 64 detector row, and triphasic CT was done to all cases. The parameters that was assessed by CT interior colonography was bowel wall thickening, mesenteric hyperemia, mucosal hyperenhancement, and enlarged pericolic lymph nodes. Bowel wall thickening was further divided into normal, mild, moderate, or severe, and the scoring was divided into score 0, with the thickness less than 3 millimeter, mild from 3 to 6 millimeters, moderate from 6 to 9 millimeters, and severe more than 9 millimeters. Our results: out of the 50 patients, about 27 cases was active cases, and only 23 have inactive disease. Then, regarding colonoscopic findings, there was loss of normal vascular pattern, bleeding on touch, friability, and erosion that was significantly prominent in patients with active UC in comparison to inactive cases. Regarding CT interior colonography, bowel wall thickening was present in 74% of active cases and only 34% of inactive cases. Hyperenhancement, 66% of active cases and only 21% of inactive cases. Mesenteric hyperemia was more significant in active cases than inactive cases, but enlarged lymph nodes are equal in both groups. Regarding histopathological examinations such as crypt abscess formation, cryptitis, surface erosions, and infiltration by inflammatory cells are prominent in active cases, and they are well correlated to all parameters which are described in CT interior colonography, including bowel wall thickening, hyperenhancement, mesenteric hyperemia, and enlarged lymph nodes. Regarding basal plasmacytosis, goblet cell depletions, metaplasia, which are signs of chronicity in UC in histopathological examination. There was no correlation with any of the CT interior colonography findings, such as Powell wall thickening or hyperenhancement. Discussion. Modified Mayo score is commonly used to assess the severity of UC. It is composed of stool frequency, rectal bleeding, endoscopic appearance, and physician assessment. لكن المشكلة إن بعض الأحيان ما بيكونش available إن أنا أعمل كولونوسكوبي خصوصا في السيفير كيسز، بلس إن الكولونوسكوبي مش بيديني كلو عن الإكسترا انستاين مانيفستيشنز. ليه اتعمل الاستادي أصلا؟ فكرة الكورليشن ما بين السي تي انتيريور كولونوجرافي والهيستوباثولوجي إن دايما أي ستيج اوف هيستوباثولوجي بيقابلها ستيج في السي تي أو تشينجز في السي تي. في البدايه بيكون في ميوكوزال هايبربليزيا edema and congestion ودي بتظهر في صوره hyper enhancement. Then ulceration and erosions appear in the form of mucosal papules وبعد كده بيحصل infiltration of inflammatory cells with hyperplasia of mucosal layers and fatty deposition leading to loss of histration. في النهايه بيحصل hyperplasia وفibrosis في الماسكولاريز ميوكوزا. This will lead to eventually luminal narrowing. In our study, CT interior colonography findings were statistically and significantly correlated with clinical aspects, including ulcerative colitis clinical activity index, and were correlated to histopathological findings. It's also, we found that there was statistically significance of CT interior colonography findings in detection of inactive disease in the form of absent crypt infiltration and crypt atrophy. Repeated attacks of inflammation associated with chronic mucosal injury, which is manifested histopathologically by basal plasmacytosis, goblet cell depletion, and metaplasia, and none of these features show statistically significant difference with CT findings, indicating that CT is not specific in detecting chronicity. Conclusion, CT interior colonography is a good tool for diagnosing disease activity in UC and can be used hand in hand with conventional colonoscopy to assess the degree of inflammation in ulcerative colitis. And thank you.
شكرا.